second session. It's reviewing progress, troubleshooting, and directly addressing some likely barriers to progress. Trying to help the teenager with triggers and dealing with context by working along 3 pathways that are suggested from the cognitive behavioral literature. And they tend to be focused on skill building and taking advantage of strengths and assets in one's environment. So it goes shorter, in part because you're not having to build a base of understanding the teenager's drug use and their in figuring out goals. But so reviewing progress, how did it go? If there were homework assignments, you get to ask about how that went, what parts of it did you like? If it didn't go well, see if you can get a discussion about what went wrong. Why do you think it didn't go well? So what would be some positive, motivational, enhancing statements to give a teenager who says, it didn't go so well? They maybe don't know why it didn't, but they just said, I had trouble meeting the goals. I didn't do it, even. So to keep the motivational enhancement ball moving forward, what would be some ways you could respond to that? What do you think?
What got in the way of you doing it?
Say it again.
What got in the way of you?
Right. Get more details about what do you, tell me about the situation where you tried and it didn't happen. Get a discussion, and thus you get to help them analyze, sort of the functional analysis of what got in the way. Exactly. So in other words, you don't turn it into, oh, well, it's a failure experience. You turn it, let's learn from it. Exactly. What else?
They may have such high expectations of themselves that just because they messed up one day, they just throw it away like, oh, I can't do it. And then maybe by dialoguing, well, what did you do? Then there are little nuggets that you can find to reinforce and say, wow, that's better than you did before, because remember before you did this, and just kind of like, and give them some reinforcement for whatever it was that they did do. At least thinking through it.
There you go.
Stop myself, before I was going to do it, but then I did it anyway.
Right. I stopped for 10 I had to stop, a pause moment, but gee, it didn't work too much, but I at least thought about, better than before where you didn't even think about pausing. Right. Reminding the person that, hey, change can be difficult. Maybe the habit had a long time to establish itself. It can be tough to change that habit in a short amount of time. Exactly. Conditions might not have been ripe to make the changes. Maybe, home life or whatever got in the way. Yeah, disabusing that it's a failure not to have success, because these are in many ways we got a lot of entrenched problems that we're trying to change quickly. So using it as a learning experience, troubleshooting, and encouraging that that's very normal, that you might not get the kind of progress. Even progress is, I thought about it even though I didn't do something. That is progress. Excellent. So now we get a little structured. It's a good idea to roll out the ready to change worksheet. Again, just as get a ballpark. See if you can get the person to show that there's some improvement. So you roll it out. The big key is doing the 1 to 10. Same scale. You have in your chart how they responded the first time. You get to compare ideas to see if you got improvement. Did you get somebody that nudged their way up a second, some more higher numbers second time around? That's all positive. You reinforce it. It has the same bottom part. You can fill that out yourself, or you can have read those aloud and see if the teenager has input on where they are situated. But we spend time on just getting their score and commenting on that. Then there is the core of the second session. By the way, you may have already filled up most of your second session by getting progress report, brainstorming, troubleshooting, and finding out how they're feeling about change. You may have already taken up 45 minutes. If you have, you want to get to, all right, time for longer term goals. Let's because this is the last formal session, and you have to leave time for that second session for goals. But if not, you have a chance to fill in an opportunity to go through 3 exercises or a mix of them. There's 3, you wouldn't have to do all of them, that help the teenager and you learn about what specific skills they might benefit from to help with the typical challenges of behavior change for teenagers, including drug use. And these are all in, I think, the coping decision-making skills category. There's 3 of them: dealing with peer pressure, enhancing decision-making skills, and using social supports. So they're all or directed exercises. We have worksheets and guided interviews for all of them. Let me walk you through. Dealing with peer pressure, this is the problem of learning to say no to using when with friends or in a social situation. And here are some ways that teenagers say have been effective. So this is in the manual, and the idea is to read aloud these refusal techniques. And some of them are things a teenager can say or just have or do, and ask the teenager to comment on if they think that would work for them. How do they feel about that? Have you ever tried it? What would it be like for you to try it? Just take a second, read those. So this was an effort to try to help teenagers when they're in the heat of the social moment or the heat of the recreational partying, how they might handle and not lose face. So it's one of the greatest fears of a teenager. Well, okay, maybe I'd like to, or I could envision using less drugs, but I don't really like the idea of me going against the grain of my friends and then losing social status or social standing. And this is an effort to try to minimize that problem. This comes from teenagers that have said, you know, I worried about that, but I found that some things work pretty well. And just one quick, it's amazing how many teenagers that try this say, you know, the worst case scenario didn't happen. My friends were okay, you know, they might have kidded me a little bit about I'm not using, but you know, I wasn't thrown out of the social group. I wasn't ostracized.
Actually, I've experienced teenagers when they have said no, that their friends kind of like look at them funny, but then respect them for making those choices, and then don't pressure them or anything. So, so
exactly.
It's like this stand, like, wow, you know, you're pretty strong. You can say no to this. You know.
Right. You might even get some stripes for it. Yes. Yes. Well, it did strike us that the biggest fear, perhaps, is over-exaggerating that concern. And some teenagers have even used the excuse, well, I'm going to get randomly drug tested if there's any concerns at home, and then if I do, if I test positive, I'm going to be in big trouble, blah, blah, blah. Kids in the court system can rely on that. Some have used it as, well, my parents are threatening to home test me, you know, and if they caught me using or if I detect positive, I'm going to be in big trouble. So throw the parents under the bus as opposed to someone else to help with that situation. So that is a chance to engage. The idea is to read these aloud, get some feedback from the teenager. Temperature reading, is this something you ever tried? Makes sense? Could you imagine using this with your friends, etc. Okay, then there's the exercise to try to get teenagers to think more about how to engage in second thought, pausing mechanisms, how to use the front of the brain a little bit more and not be so reward and incentive directed. And so this is the manual guides you through how you introduce this, and you're basically introducing a red, yellow, green light type exercise. Red light, okay, stop before you do or say anything and think about the situation and the options, both verbal options and behavioral options. Okay, then choose one. All right, at least you got some options. Decide on choosing among some options. And then, of course, you know, verbalize or show the behavior and then evaluate afterwards. It's the old idea of not reflexively acting or saying something, but pausing, reflecting, coming up with options, and then choosing. Even if the options aren't always the best, it gets the teenager to learn more about the importance of second thought mechanisms, pausing and reflecting, and at least choosing from a multiple choice set of options they've given themselves, as opposed to perhaps what is more reflexive. So to help with that, after you go through this guided exercise and you ask the teenager to comment on it, does that make sense? Have you ever done this? You could give them these situations. Here's 2 of them we came up with, and the idea is you read the scenario aloud and ask them to comment on how they might use the 5 steps if they were in that situation. So it's just to help embellish the use of this exercise. You might not need to do this because you're getting some pretty good input and good discussion. Maybe you've even got a personal example where you know this occurred. Remember, you've talked about triggers, you've talked about context, situations. You may have been troubleshooting goals, right? In the first 15 minutes of the first session, you might have found out some situations where your client didn't show perhaps the best decision making. They didn't stop and choose. So you get a chance to go back and say, okay, remember 10 minutes ago, Sally, we talked about when you were with your parents and this big argument came up and you blurted out some pretty nasty statements and your parents got real mad. So did you think about some options before you blurted it out? Oh, okay, apparently not. Well, let's think through what might have been some things you could have in your head said about some options besides the one you chose. You know, could you have said it a different way? Could you, with less emotion? Could you walk, you can use an example and see if you can get the person to realize, okay, I guess there are times when one could stop. You have to remember that the adolescent brain isn't incapable of stopping and making options. It's just, it's a little tougher. The neurology and the neural wiring is a little bit more conducive to emotionality, but there surely is all the capacity there for a youngster to stop and pause. Okay, the third among these 3 skill building is the getting the discussion about, is the teenager in an environment where there's social supports, and if so, are they using them enough? Social supports can, of course, help with all the coping challenges, help with drug-free lifestyle, help with behavior change. And so the literature suggests that this is a valuable, powerful predictor of success after treatment, that a person says they have a social support network that was supportive of their recovery. So it's a chance to get the teenager and you to talk about it. You may already know a lot about their environment and their social supports or lack of. So you get a chance to leap right into, so, during the last week or so, have you relied upon your brother that you said have been kind of helpful at times? Have you had a chat with him? Is there, your boyfriend, girlfriend, supporting your new approach to how you're going to handle drugs? You may know already something. If not, the guided worksheet to help you talk about, is there someone that you can rely on? Is that a person an adult? Is it a person that's the same age? It also asks if you help others. So the thought here was to also engage the teenager, step outside how they could use others to help them, but see if they show any tendency to help others. So why do we do this? Well, it's a little chance for you to get to know a little bit more about your client. How much does a teenager step outside their world and help others? It's an important, valuable, I think, human trait to learn about in a client. It's something that you might want to encourage teenagers to do more of, because it turns out perhaps the teenage time of life isn't one where you think as much about helping others as you get sort of wrapped up into yourself. But it is, when people have engaged in this, they find that it's a very reinforcing experience. And maybe our culture doesn't encourage enough of it in the teen years, or people are in certain environments where it just doesn't happen. But it's a tried and true human report that unselfishness, helping others, does provide just a wonderful feeling of affirmation. The neuroimaging science even supports that. You get the brain to light up in the pleasure centers when people are doing unselfish things or thinking in unselfish ways. Treatment programs many of them have taken advantage of this, I think, and they spend time having their clients think about how they're going to help the community, how they're going to extend volunteerism outside the treatment program and take on a community project. And so we got a lot of feedback from treatment programs and kids in treatment that this was really an interesting experience. I'm glad I did it. I want to do more of that in my life. And perhaps that motivates some to become sponsors in the chemical dependency recovery world. But a chance for you to talk about it and see if the teenager has part of their life where they give to others. If not, it might be a chance for you to see if there's an opportunity for him or her to engage in that. Okay. The social support worksheet, just 2 pages, goes through, chance for you to fill in the blanks for these various themes that I brought up. Who's out there to help you? How can they help you? And then discussing are there ways that you might help others. So to the conclusion. So you're, in theory, the last session with the teenager, at least formal, chance to summarize, talk about goals, and encourage you, or encourage the client to think about longer-term goals. You want to revisit the abstinence issue. Even if you discuss, well, what would it mean for you, Sally, to be drug-free? What would that be like for you? How nervous or scared are you about that? What's your worst fears? Just getting the discussion out in the open. How much of your life would you have to change? How much of your, social recreational life? How much of your friends would you have to change? What would home life have? How would that have to be different if you felt like you could be comfortable drug-free? All those things can be discussed. In a 2-session counseling arena, you're not going to have much time to, of course, go into great depth with those issues if they're complicated and well entrenched in the teenager's life. You also have an opportunity, of course, to do booster sessions. All the results we have are when we stopped after 2 sessions with a teenager. So abstinence rates might be higher if people do booster sessions or continue on. We had a lot of teenagers wish they could have gone on. We couldn't for research purposes. But we had a fair number, I don't know, I say a third, teenagers that liked what was going on, they wanted to continue on. So that it could happen. And I'm not sure we would have had them in the intervention if they were told up front it's going to be 10 sessions or 20 sessions or long term. But I think that because it was viewed as short, there wasn't much risk on the teenager to engage, and then they found that it was a reasonably favorable experience. More on booster sessions because you want to revisit that after you've done the parent session. Okay, so before we move into parent session, comments, questions about that second adolescent one?
I have a question about your social support assessment.
Yes.
I've used, I think this comes from 12-step. I've used the exercise of making a list on one side of the paper of your social supports that will support your sobriety or your stay
Yes.
clean.
Oh, that's
on the
good.
other side, the ones that will not. What do you think of the pros and
Yes.
cons of using the not side as opposed to...
Yeah. Oh, that's good. I mean, that would help clarify, okay, there's social supports that might help you, but there's also social supports that don't. Let's talk about that as well, because can I steer you away from them, or let's talk about why they're not helpful. And, oh, yeah, no, that's good. The contrast there, I like that. Yeah, that'd be good to add on. That's an excellent embellishment. Yep. Might have to do that for the next edition, put that in as a formal thing. So I also understand that we're getting near a need for a break, but here's what is best to do. I tell you about the parent session, we walk through that, and then you're going to have an opportunity to work on a case study in small groups, so we can mix in a break as well as the 20 minutes I want you to work on in small group on the case study. So we blend the two, then we come back, process the case study, go over implementation, have Q&A. How's that? Can you hang in there for another 10 or 15? All right. Now the parent session is, in some ways, perhaps kind of silly to do. What can you do in one session when, the family life might be chaotic and the parents might be dysfunctional? But we thought it was so valuable to at least get the parents in the mix, and maybe that would be more of a motivator for them to do more formally outside the intervention, and thus keep the the behavior change ball rolling forward with parents involved. So we thought, well, there's obviously some things we can talk about. There's some parenting principles, recovery issue principles we can discuss with parents. But I think our ultimate goal of this was getting the parents aware there could be an issue and they could be part of the solution, and hopefully they could take advantage of that and help promote whatever change, whether it's formal, extended counseling, or whether it's changes they're going to make in the home, have that move forward. So, introduce the program, talk to the parents about their drug attitudes and behaviors, talk about parenting practices, and then how they can help promote the child's goals. A reminder, there's a parent questionnaire. It's short, but if you have a chance to do that beforehand, that'll save you time. Just one theoretical discussion at this point. The idea, yes?
How do you decide when to include the parent? Like, when you did your study, did kids
Excellent.
give permission to tell
Great.
the parents? Because
Good.
when I read it, it said that, when you introduce the program, you're telling the parent that your child is
Yes.
using it.
And that's when, good point. So it's a question about introducing this to parents and the problem that may raise with some teenagers not wanting their parents to know that they have a drug use problem, even though they might be willing to talk to a counselor privately about it. So when we did our research, everyone had to know up front that drug use was the issue. We benefited that because our referrals were from schools where the student had already been caught with a drug incident. They had to, of course, report it to the parents because they had to. So the schools did. So the cat was out of the bag for everybody. But we know from its use in other settings where the research design wasn't in place, or it wasn't a school type referral in this way, that there are instances where the teenager is willing to do a one-on-one and do the 2 sessions, but does not want the parents involved. Because by involving the parents, that means then the parents are going to know there's a drug problem in their son, daughter. And so that has happened many a times. And so if you do this, my hunch is, it's going to depend on where you are and how things unfold in referral networks, but there's going to be a certain percent of time where you're going to get a teenager, if they're the first contact, will say, I don't want the parent involved. You could tell a parent that we're in counseling, you might have to do that. But nature of it, not disclosed, the parent's not going to have a session because then the drug use issue's coming out of the bag.
But how do you handle consent, like the parents?
Well,
They have to give consent for their kids doing some sort of counseling?
Well, in our state, this depends on, so the question is about consent. This depends on both local and state regulations. So in the state of Minnesota, at a certain age, a youngster can get counseling without parental consent. So we have at 16. Some states that varies, either higher or lower. Some states are even lower. So you have to figure out, well, what is the regulations I have to live with either in my state or maybe locally in your own clinic. You might have a policy. Don't want to, have any treatment unless the parent knows about it. Now you could have a parent know that there's treatment for the teenager for problems, and not disclose the specifics, and so you could keep the drug use issue still behind the curtain. Parent knows there's treatment, consent forms signed saying it's okay to do counseling with my son, daughter, still no disclosure on the specificity. You could still do that.
I think what I like about, getting the parents involved is that even when the child gets out of this intervention, there's accountability, and the parent is still involved and knows
Right.
and can keep that kid
Right.
in line without, and give that kid some sort of a support
Right.
versus none.
So a great point about all the advantages of having the parent involved, and I'll just reiterate what was mentioned earlier this morning with the meta-analysis. Programs that had family component tended to rise to the top of most beneficial. In my hunches, it's mediated by the exact reasons you gave. Parents are now more aware of issues. They perhaps are sharpening up their parenting skills and behaviors. They're helping promote recovery by doing all kinds of positive things in that direction. And they may be more alert and stepping in and intervening with the teenager's health more urgently because they see that there's an issue at hand. Keeping the parents in the dark on the sidelines, makes it tougher for all those things to happen. Right. Excellent. All right. One of the things we're trying to do with the parent session is to improve and drift parents towards that desired quadrant there of being very good at disciplining, positive behaviors of monitoring, disciplining, as well as showing positive support behaviors. So it's good communication, connecting well with the teenager, as well as being aware, being alert, having rules, making sure you're monitoring how things are going. When rules are broken or there are violations of agreements or rules, there are consequences that are appropriate, etc. Many parents drift out of that nice blue circle, and the one idea is to try to get parents to optimize those two types of behaviors. So, leading off with this session, the idea is to get the parents to talk about what do they hope to gain, what you get a chance to review the goals that you've established with the teenager. Chance to say, here, we're trying to get the teenager to be healthier. We're trying to get him or her to do the following. You may have noticed this already at home. He or she's trying to do certain things. If you notice that, are you supporting it? Chance for you to even get some of their insights about it. Now, you might want to talk about the parents' attitudes about drug use and alcohol and drug use, as well as behavior. Got to proceed cautiously here. Only do this if you think, okay, I think I have a good rapport with the parents. I think this is an okay topic. Maybe they've already brought it up, so it would be something not out of the ordinary. But you can imagine, some parents, they don't think there's a problem in their own behavior. They think it's the teenagers was the one who screwed up. And being asked about their own alcohol and drug use, even though it might be appropriate, might seem to be a bit accusatory. So you got to proceed very cautiously here. You may know more about alcohol and drug issues later when you do some of these parent worksheets that are coming up, and then you could also revisit it. So we tell you in the manual, proceed very cautiously if you want to open up this topic area. You surely can get to it later, so you don't have to do it too early. Okay, but to guide you along understanding the parenting behaviors in the home environment, there's the parent worksheet. This highlights the parent-child relationship, discusses how specifically parent can help with the teenager's goals. So it focuses on what is the family like, how do you get along with him or her, we don't use the word cause anymore, what do you think may have contributed to your son or daughter's problems or anything you've noticed that may have contributed to it. So there's this worksheet here, you get a chance to go through the questions, write down some answers. Even if you're not getting much detail from the parents, there's a lot of questions here, and it gives you a chance to get a little insight about the connectivity between the teenager and the parents. Okay, then we're moving into a more specific skill about that helps parents do a better job of communicating favorably and dealing with stress in as less toxic a way as possible. And this is the 6 Steps worksheet. This is a strategy to use when there's a difficult situation with a teenager and you need to discuss a topic, but you want to make sure that you're not being argumentative, you're not being confrontational. And so it's the 6 steps, a kind of a standard way of pausing, reflecting, expressing one's concerns, giving a chance for the other person to express their concerns, and then reach some resolution at the end. This is a communication style that's in various communication literatures, and it matches up nicely with motivational interviewing. So the way you deal with this is you read aloud the descriptor of the steps, and then you read the characteristics, and you ask the parent to comment on it and say, well, okay, does this make sense to you that you'd start out with an I care statement? Have you ever done that? What's it like if you've done it? And I see, I feel, listen, spend time on listen, because the biggest problem with stressful or confrontational type incidences with teenagers, the parent has a difficult time listening to the other side of the story, even though parents feeling like they're getting lies from the teenager, or they're getting selective memory, or they're not getting the kind of answer they want. It's very important in these instances to disabuse and to diffuse some of the anger by spending time listening. But the last step is, the last two, is what the parent says they need to have happen and how the parent will also contribute to the solution. So in some of these difficult situations, parents have to weigh in with what needs to change so that the family rules are followed. And so that's inherent with number 5. But in number 6, it's the opportunity for the parent to say, well, I will also help with the change. It's not just the teenager having to exert all the responsibility for change. So the 6 steps: I care, I see, I feel, listen, I want, I will. You read these, read the scriptures, and engage in dialogue. Okay, more about family life. This is now back to alcohol and drug. This is a worksheet about what discussion there is and rules about alcohol and drug use. So here's where you get more formally, and it starts with, so has the family had discussions about alcohol and drugs? And if not, what do you think should be the policies and the rules? So this could be a chance where you get some interesting insights from the parents. Are you going to get them to tell you that they smoke marijuana in the home? Are you going to find out that there's intoxication going on a lot, or there's a lot of availability of chemicals? You're going to find out perhaps about some of these things. This is where you have to tread carefully. You got to figure out, okay, how much do I want to discuss these issues? These are, I got some really big ones here. If you're finding out there's a lot of drug use in the home, or the attitudes are very permissive, and so I think the best way to handle it is you want to reinforce the importance of parents thinking through their behavior and attitudes about drugs and making sure that matches up with the goal of trying to get their teenager drug free, and seeing if you can get the parents to agree. Yeah, that does make sense. I guess it would be kind of a contradiction if we're doing one thing, we're asking our teenager to do another. And see if you can get parents who are perhaps too permissive or their behavior is over the top. See if you can get them to rethink that and adjust their behavior and their thinking. I'll be the first to admit, that can be tough. But just bringing it out in the open, saying, you feel that it's quite important. I feel, Mrs. Jones, it's quite important that, the family life it's got to support your son and daughter's, or your daughter's efforts to be drug-free. And part of the family life that's got to promote that is if everyone in the home is kind of on the same page with use of alcohol and other drugs. So it's going to be hard for Sally to maintain this drug-free approach if she sees that there's just a lot of free-flowing alcohol being used, even though it's legal. And I know you don't have a problem, Mrs. Jones, but it's just going to be kind of a tough one for your daughter to accept. And you can imagine your daughter's going to use that maybe as an excuse even to say, well, why should I? Because people in the home aren't also helping me out. So a chance for you could even, this is one where I get more my light confronting. I weigh in and say, boy, it sure would be helpful for promoting a drug-free lifestyle in your son or daughter if you could do blah, 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 or do less, blah, blah, blah. Of course, if there's illegal drug use, you got to try to see if you can bring that to a halt, or at least discuss how that's problematic. But I think for most homes, it's how much alcohol might be used by the adults, and are they getting intoxicated in the home, etc. Things to talk about. This is one where you got to figure out, okay, how much room have I got here with these parents? Do I know them well enough for a parent? Is this something that will blow up in my face, or is this something, no, I think I can approach this and we can maybe have a good discussion on it. Some of the challenges of the parent session. Anyways, a worksheet to help you guide through starts out with household rules, and then to see if you can get a discussion about their own behaviors and attitudes. And then it's a chance to review the parent questionnaire. Remember, you either gave that beforehand or at the front end, and this is a 10, 12-item questionnaire. And the old use it as a guided interview, chance to take some items and talk about their answers. We've noted 3 of them, 5, 7, and 10 out of the 12. It's just a 1 page. All of those struck us as interesting, whether you got a disagree or an agreement statement. As a parent, I am willing to do whatever it takes to stop my child from using, number 5. Number 7, my child's use of alcohol or other drugs is just typical teenage behavior. If they agree to that, it's great to ask them, so what is typical for you then? See what their view is. They might have a very slanted view on that. I tried to help my child change, but it didn't work. So if they haven't tried to help, seeing if there's, are the things you've heard about or learned about since your son or daughter started the program that allow you now to try to help? Have we opened up some ideas for you of ways you can help? Of course, if they have tried, what have you done? That's great you've tried. Let's talk more about doing more, especially if it's the right stuff. So a chance to get a little bit about the parents' view of, and perhaps, I guess, their normative view of adolescent drug use, as well as their motivation to want to help you with promoting the teenager's goals. So the idea then is to review things at the end of that worksheet, because you pretty much come up to the last minutes of this final session, reviewing disciplining issues, parent behavior, attitudes of drug use, and how they're going to promote the teenagers' goals, emphasizing what they want to keep doing that's perhaps good, what they need to perhaps do more of or less of. And you're going to run into a lot of parents, if you already haven't, where the parents are doing all the right things, but unfortunately things aren't going so well with their teenager. And they might even have other teenagers that they've raised, and they tell you, well, this never happened to the older brother or sister, and we're treating our younger one the same, and they're just getting different outcome. And that surely can happen. And parents might be doing all the right stuff. Tell parents to hang in there, to keep up the good fight. The worst thing you can do is give up. Parenting still matters throughout the teenage years, and even if you think you're getting less impact with parenting from one child versus another, it doesn't mean that you're not doing a good job. Sometimes things just don't work out. And even your own biological children can differ greatly enough that they can have very different trajectories even though you parented them the same and with the optimal principles. And sometimes that's the best advice parents can get, and it can be comforting to parents to know that you recognize that. So the idea is to have a closure session, though, with the teenager and the parents, the last 5 minutes. So think that through. If you're having a parent session, the teenager, if they need to, you'd like them there for the last 5 minutes, they need to come along to the meeting and at least be in the lobby waiting, because you want to have the first part private. That can be difficult to do in some settings. It's optimal, though, if you can try to have that closure meeting. Everyone gets to review what are the goals, how the parents are going to help the teenager. And it's a good chance to discuss with everyone what might be next. Do parents and teenager want booster sessions? Or is there a need for referral? Do you want to discuss with the parents about perhaps problems that have emerged that you realize that could benefit from more specialized care elsewhere, or perhaps in your own practice? So it's a chance to talk about what could be next, as well as just an opportunity to review how everyone's going to try to be on the same page. If you did booster sessions, what would that look like? Of course, you could space it out however you like. We know from users of this, a lot of them to recommend something in 1 month downstream, chance for people to work on the goals, see how well they've done. But any booster session with a teenager you used, you really could just repeat the second session. A lot of the tools and tech strategies of the second session you could repeat. You get to, discuss goal progress, troubleshoot barriers, review willingness to change. You could pull out the willingness to change or readiness to change worksheet 2 and just do it again and again and again. And the skill building components, you could revisit those, and because those are often barriers to change. See how they're going. See how the just say no is going. Are you using social networks enough, etc. So in many ways, you have structure provided for you with the second session to use in booster. For the parent booster, if you were to have that, you really can repeat a lot of the same things you've discussed with the parent. How is the, have you got those family meetings? Have they occurred? Have you got the rules nailed down? Tell me more about what's it like trying to help your teenager change. What are the things you can do more or less of? An opportunity to revisit those same issues. Oh, I've also mentioned here, you surely can do the pros and cons exercise again with the teenager. Chance to see if they've altered that perception of the benefits and the negatives. Perhaps you're getting more negatives of use than before, and perhaps less positives of use. Okay, and then I just want to mention a little bit more about referral. This is, again, calls upon your clinical expertise. So there's multiple referral options. You might realize, boy, I've got to refer outside my clinic or outside my expertise because some new issues arose that might merit attention from someone else. Maybe I can do it in-house because we've got the expertise, so I'm really just going to extend treatment both perhaps in my clinic or in my own practice. Maybe you need more assessment. Maybe you've realized, boy, maybe there's ADHD lurking, or maybe one of the parents is suffering from depression, and maybe that's also part of the referral. Something to think about, in the clinical world, you realize you might have an endpoint of a so-called packaged, manualized intervention or treatment, but many times there's other clinical issues to deal with. Okay, comments, questions before we have you tackle the case report. All right, let's do this. So you already have in front of you a handout, the Lynette, which I think is a few pages. And the idea is to do a combo here of both a break and working in small groups to discuss the case. Now, if you haven't read the case, you realize there's a few pages that describe 2 sessions of the counselor with Lynette. And then at the end, you'll see 3 questions that I want you to discuss in small group, and then we will discuss them in the larger group. I'll pull for some open discussion from everybody. So you just have 2 sessions. There wasn't a parent session with Lynette, but the counselor tried to follow basically a brief intervention type format, with Teen Intervene being a major structure for it. So I hope you had a chance to have a little small group discussion. We will briefly review the case. So for some background, I'm going to just read the little bit I have on your case report. Lynette is a precocious 16-year-old female who is a sophomore at an urban public high school. She's not very interested in school. Her last grading period, she got mostly C's. She was referred to a school counselor because a teacher caught her with a small amount of marijuana. A brief clinical interview indicated that Lynette is a weekend marijuana smoker and that she had experienced a significant life stress of late. Her father passed away about a year ago, and as the only child, the adjustment for her and the relationship with her mother has been difficult. Lynette admits that she started smoking about 2 years ago and has increased her use since her father's death. And Lynette requested that the mother not participate in the brief intervention, so it was just 2 sessions. I'm going to go to question number 1 for the group, and the idea is to have folks to enter into discussion with me. Feel free to speak up. So I always thought with this case, at least the detail we had, there were some interesting and good things the counselor did, but perhaps some things, if you were the supervisor, you might have suggested the counselor could have done differently. But let's, doing a pros and cons, let's start with the pros. So what are some of the things you liked about the way the therapist handled the 2 sessions? What would be some of the things you'd give nice motivational enhancement credit to? Yes?
I like that she sort of echoed that she had the right to make her own decisions
Right.
in the beginning.
Exactly. Give it that old client-centered responsibility on the person. Therapist isn't going to try to dictate what to do. Very good. Yes.
I think going along with that, I like that she let her set her own goal in the first session.
Right. Exactly. Maybe it wasn't the best goal, but I think she had to steer her a little bit, but yes, but laid it out, okay, what would you like to do first? Let's get that out in the open. That's, I think, a nice way if you want to influence goal setting, have the person first advance the goal, and you always have a chance to say, well, what about we slightly tweak it type of thing. Very good. What else? Anyone want to talk about the second session? Or?
I was going
Go
to
ahead.
say in the first session too, it sounded like initially, it wasn't a straight path. So by going into kind of the grades and things like that, she was able to develop some discrepancy there and then steer it back towards substance use.
Right.
The therapist
Yes.
was.
Right.
Which was really clever because if
Right.
you had just gone straight path, you wouldn't have gotten any kind of goal set.
Right. Looked like she was no interest in talking about drugs, so all right, let's try the school thing, perhaps using leverage that the dad would have been upset if there was, a problem with grades, and so goes that route, and then of course connects the dots. Hey, they might be related, so got a little leverage. Yep. What if the Lynette had said, well, I don't really want to not smoke before school. That helps me get through school. So, the grade issue might have been on the table. Lynette said, yeah, all right, I should try to improve my grades. But let's say Lynette doesn't want to change the marijuana use pattern. What might and let's say that's non-negotiable. What could the therapist have done to still try to get the grades thing moving forward? Any thoughts?
Well, maybe like to review what her grades were before, and what were your grades before you started smoking,
Yep.
And
Exactly.
to compare, and do you see that maybe that there's some sort of, correlation between,
Right.
Your pot smoking?
Excellent.
you know,
And let's say, yes, because you still could see with developing discrepancy if you could get Lynette to move off of her rigid point of view. But what if she still doesn't want to, let's say she's going to leave the first session, not claiming she's going to change when she's going to smoke, but what could she leave the first session with that's related to grades that maybe you could use as leverage later? Go ahead.
Like their option would be recording how many times she's smoking and
Right.
how that affects
Right.
her doing homework.
Yeah, or what her day was like.
Yeah.
Yep. How much, she could do monitoring, how good is your homework completion each day, as well as, and then also indicate whether you smoke before school or not. And you could use that as leverage later. You could also work on, okay, well, what are your study habits? So let's talk about those. And, can you alter her study habits? The reason I'm saying you could use it as leverage is maybe you get her to change her study habits, still not much improvement, and then you could use that as this using before school is really the big problem here. And unless you do that, Lynette, you're not going to make much inroads on your grades issue. Yeah.
The other way to do it would be to connect dots on the other side, saying, I wonder why Dad would have been so concerned about
Right.
this. What's
Right.
the big deal about it?
Right.
And then see if we could elicit her discussion.
Right.
Rather wanted me to
That's
go
good.
to school and I need to grades at this college. and I need to do
Yes.
that.
Yes, that's excellent. Using the unfortunate life stress event, though, as leverage for you to see if you can get someone to reorient their thinking. Yep.
Well, she admitted that she was a weekend marijuana smoker, but yet she smokes up before school.
Yes,
and
right.
It's non-negotiable to not
Right.
smoke for homework, instead of homework.
Right.
So she smokes every day. So that's a discrepancy. You say you're a weekend,
Right.
but you smoke before school.
This might also have been a phenomenon of sometimes you get one story at perhaps a pre-assessment with someone you haven't established any rapport with, and then later when there's a little relationship with another person, you get a different story. My read of it is, first being caught, that's what she's admitting, minimal, but then when she's perhaps feeling more comfortable with the therapist, admits to more. But you're right, it's not, at one point it's not just weekends. So, I mean, as a therapist, if that was in one's assessment notes or the referral notes, and then you're getting a different story, it'd be worth bringing that up. Say, okay, so let's talk more about how much of the smoking. So on one hand, you said to someone just weekends, but now I guess there's some use during the week. So tell me more about that, Lynette, because there was a inconsistency there. All right, we're loving the counselor, but there must have been something that didn't go so right, maybe, not so good. What might be some things you could have tweaked? Go ahead.
I would have definitely, well, there were two things. One, not to mention the grief issue with the dad, the passing of the father, and to note the drug use increased after the father passed away. And the agreement to meet 3 months later,
Okay.
I would have not done 3 months. It's too far
Okay.
out.
Uh-huh.
And to see her, so, I mean, she's obviously smoking every day, and so,
Mm-hmm.
you know, I would have seen her maybe like in
Sure.
2 weeks. I wouldn't have gone that long.
Right. Very good. So your first point, you mean the therapist didn't bring up enough the possibility of increased use in the life stress event, right? And wouldn't that have been a good issue, insight, functional value, let's learn from this, right? Let's figure out other ways to deal with it. So there was a chance you surely could have that as a major goal of that's not directly related to drug use, but it's in the ball game, right? All right, well, let's, dealing with the major loss in one's life, how are you dealing with it, and what are ways we can talk about that are better? And can that be non-drug? Very good. The 3 month, one wonders why 3 months. Now, we maybe don't know about, maybe she floated, let's meet in a week, and got the cold shoulder on it, and maybe that was what was the best case scenario. But there was some momentum going there, and you can make a case if Lynette wanted to meet again, you wouldn't have to wait 3 months. One advantage of 3 months, I guess, is, well, you get to see how things are playing out over a longer period of time, and maybe that can be informative. But yes.
I would have revisited getting her mother in. She talked about.
Excellent.
Her mother was a good resource and someone she could confide in.
Yes.
So that would have been a good time to revisit that.
And exactly. Therapists could have gone many ways there. Do you want me to, can I get permission to talk to your mom to see if we can get a session? Or what about you bringing it up with her, and let's talk about how you might do that. Exactly. Could even role play what that would all look like. More depth about why she doesn't want mom involved. Yeah. Maybe the drug use issue is a hot topic. Well, the therapist could say, well, we won't talk about that. Let's talk about dealing with the life stress both you and your mom are handling. Maybe we can talk about boyfriend issues. Maybe we can talk about school. There's 3 or 4 things that could be on the plate. Therapists could agree not to bring up the drug use issue. Go ahead.
This is different, just the
Yeah.
appropriateness of the goal of not using the abstinence goal.
Yes.
Seems
Yes.
pretty far out of reach, and it didn't seem like it was Lynette's idea, which is a concern.
Yes. Right. Kind of leaped into that. Might not be coherent, congruent with what's been going on so far in the session. Perhaps leaping ahead too quickly to it. Perhaps could talk about what it would be like if you were to go abstinent, Lynette. What would that take? Doing that, as I mentioned, playing out a script with the youngster around those issues. Yeah, excellent. All right, the last question I had, if you had the session with the mother, what kinds of things would you talk about? In addition to some of the parenting workshop things, the worksheet, home rules, what else might be a topic that would get raised?
I always told the mom the extent to the effect on her of the father passing.
Right.
Because if she's caught up in the impact it's having on her, she may not be as engaged with her daughter because of the daughter mentioned things like my mom doesn't seem to stand at my things as well, and if the therapist is looking at that at the grades as being a motivation to stop using
Right.
marijuana, and the mom's not even paying attention to that, then that's not
Right.
good support. So to what extent does she need support from her?
Yes, exactly. So mom's grief might, of course, have personal impact, but it also might be having a role in how she's viewing daughter's behavior, reacting to it. So her parenting practices might have changed with, of course, this in a rational way, a very significant life event. Also, the father might have had a major role in certain parenting that the mother, wife, didn't, and she hasn't yet, filled in the gap. So you could make a case, did the teenager drift towards poorer grades, dating an older teenager, and using drugs? Three things that maybe are a problem to some parents with a teenager. All three of those, maybe they wouldn't have happened as much or at all if the dad were still around, because maybe he was such a central figure. Anyway, I'm speculating, of course, but it's the kind of thing you'd see if you could get some insight on. It has to do with the relationship between the mom and the daughter. What's the role of the parent in the daughter's life and decisions making that she is making, health decisions she's making, and how that impacts, of course, possible drug use. All right, excellent. Any other thoughts, comments on the Lynette case? All right. We just have a few closing topics. One of them is a reminder with some implementation. To save time, you can do two things. Before you see the adolescent, you can administer the client questionnaire. Before you see the parent, you can try to administer that questionnaire. It's the paper pencils or self-administered. That saves a little time. If you're using Teen Intervene in schools, that has always been a thought that it would have a role there. It's been one where we've spent some time working with Teen Intervene. You need to, two big things that struck us in our relationship with schools. You need to have support from top administration officials. That's such a critical facet. And hopefully there's a culture, an attitude, perhaps it's formal policy of where health issues are assessed or screened for and addressed, as opposed to schools that perhaps want to avoid dealing with health issues because perhaps resource limitations, perhaps worried about the public relation hit a school may take. There can be various reasons for it, but it really helps to have both of those in place. It's been our experience that you can train school counselors, school psychologists, even though they might have a lot of focus in career counseling, but they're good with teenagers. They have really good rapport building skills. They can learn Teen Intervene and implement it effectively. So I think it has a spot in schools if you get the right conditions. Thoughts on anyone who works in schools and they've had a chance now to see Teen Intervene? Any pluses, minus, pros, cons of any thoughts about how it might fit or not fit? Want to weigh in on? We chatted a little bit at break.
Well, I think one of the things that we're all struggling with in the school system, particularly here in Florida, is the RTI process and the Tier 1, Tier 2, Tier 3 intervention. What I like about Teen Intervene is that it's, again, as you said, easily usable by a wide range of players in the school system. And it's short, it's evidence-based, so it meets many of the requirements that we struggle with. It
Okay.
would fit nicely into that, probably that in between that Tier 2, Tier 3 kind of thing. It's not early intervention, but it's, as you said, the mild to moderate substance use range.
Yeah.
So it fits nicely into the kind of structure we're struggling to implement.
So comment was, it may have some affinity with schools for various reasons. Short, trainable to a wide network of professionals, and you can make a case there's a reasonable percent of students with a mild, moderate version of the problem, and they're not probably going to get help in another arena or with other type of referrals. So if schools have the wherewithal and the resources, they surely may be promoting the health and well-being of a reasonable percent of students. All right. People ask, can teen intervention be conducted in a group? I think the answer is yes, with all kinds of caveats to keep in mind. You want to be pretty good at group therapy. It's always a little more challenging. There are some advantages of the group process, but it's a bit challenging. I think you'd want to have a closed group. That means once you start a group, that's the group that gets the sessions, and don't enter new subjects in the middle. Wait till another group can start. I think it makes sense not to mix gender with teenagers. That usually creates extra problems that tend to frustrate the therapeutic process. Dynamics of the boys and girls in the same group can sometimes lead to difficulties. And you got to think this through about how much material you can get through with a group of individuals. So, because you want to try to engage everyone in each of the exercises. So let's say you're doing pros and cons, you want to have everyone participate. And so that can take longer than if you just have one person participate. So imagine all those exercises, and you want to get a lot of group involvement. It probably means everything's going to take longer. So it's one of those where you're probably going to have more group meetings to get through all of the sessions than the number of sessions. You might need 2 group meetings to get through all the material in session 1, for example. So think that through. You might also need more than 1 hour, even just to get through half of the material in a given session, because it's going to take longer. So think about that. So I wouldn't think of it as, okay, I can do group session. I only need 2 adolescent meetings, group meetings, and get through everything, and only 1 hour. The math doesn't work out very well. So think about longer time. That's fine. If you can get, let's say 5 youngsters that, and 1 therapist. You can see that economy of scale there is very friendly if you have limited resources. So let's talk about consent and confidentiality. I just want to encourage you to make sure you understand your state and your clinic or organization's policies on this. So there's some variability about to the extent to which treatment or counseling can be administered to a minor without parent consent. Some states have pretty liberal laws on that. Some are not so liberal. You also have to keep in mind what your mandated reporting is, and there's plenty of circumstances. I've got the 3 big ones there: harm to self, state mandated reporting, and harm to others. Most of us have to deal with or keep attentive to the state mandated of abuse or harm to self, suicidality. Those are the biggies. Now, we've talked a little bit about, well, what could you do if you have a teenager that wants the brief intervention but doesn't want their parents to know about their drug use? I recommend you think this through. You've got to have a consent process in some form. If you're in a program that's going to require the parent to know about counseling, you surely wouldn't have to say in the consent form what the specific topic is going to be. You could get a parent to sign consent that it's okay for you to have counseling sessions with such and such a person. And the consent form could even say any specific information about what's discussed in the counseling session is not going to be disclosed by the therapist. Only you would have to disclose, of course, the things you're required by law. But as you may know, mandated reporting doesn't include alcohol and other drug use, even though that's illegal technically. It doesn't include that. In fact, there's a big effort to try to protect therapists not disclosing it, so that they can try to get people into treatment and without the threat that, oh boy, my therapist is going to pipeline my illegal drug use behavior to somebody, like the law or a parent. So in our research, we, as I've said, the cat's out of the bag, and the parents know it's a program for alcohol and drug problems, but our consent form says we're not going to tell the parent details about what goes on in the counseling session. So the parent knows at least there's that topic, but that's all. We have never run into problems where parents are just upset about that or tell us, well, I'm not signing up for that reason. Parents don't sign up for it because they say they don't have the time. Some parents bow out. And we've never had except one instance where there was a custody issue, and one parent wanted to know what was going on in therapy. We've never had an incident where a parent was forcing the issue about, you got to tell me the details about what my son or daughter talked about. I thought it'd be useful for you to share your experience with this.
We spoke in the break that when the HIPAA laws came in, APA had some suggestions in terms of psychologists who work with children. And one of them is to have an explicit statement that the parent signs off on, and a discussion of that statement that, in fact, in most cases, they have the right to any medical records of a child under the age of 18. But that for clinical purposes, we would ask them to waive their rights to specific information, with the exception of these mandatory reporting situations. And most parents, in my work here for the last 22 years, I've never had a parent that didn't understand it. And I just go through it and I say, as adults, we can go into treatment and it's confidential. We don't have to worry about that. If our kids are going to experience the same benefits from treatment, they have to have an understanding that you're not going to pipeline information to the parents or somebody else. And I have honestly never had a parent that refuse to sign off on that understanding.
Yeah. I think you're covering yourself. It's good clinical practice. I don't think you'll be punished for it by parents creating a problem. It'd be a rare instance. We've done over 500 cases. Like I say, we've had one, and it was a nasty, divorce, custody issue. In fact, it didn't matter whether it was drug use, and I was just that there was counseling. It wasn't the topic of drug use. It was somebody was getting counseling, and the other parent didn't like that.
If I can comment on your one case, though, I've had a couple cases along that line, and that's where if you find out that a parent, if there's split custody or whatever, you really want to have permission from both of those parents. You don't want to have a situation of saying,
Right.
oh, well, dad isn't involved, don't worry about him, or mom is over here, or
Right.
That can come back and bite you because they
It's
can
good.
basically come in and say, I never gave permission for this.
Right.
This is my child. So I like to get
Yes,
those
very good.
situations.
Yep, excellent point. You may know there's a duty to harm precaution. It is rarely used or needed, and for you to have to report where you believe your client is going to exert harm on someone else, there has to be a lot of clear-cut, rigorous evidence or belief on your part. These are the four that make up, I think, most regulations. Some states may vary this a bit, but this is generally, you can see you have to have real strong belief, specificity, identifiable person, not just a general or vague threat. Okay, anything else on consent confidentiality? Excellent. Just my 2 cents worth on learning Teen Intervene. So it helps to take a workshop. That's a good first step. It also helps to do more, and to greater or lesser extent, depending on how much you work with youngsters or engage in motivational interviewing, will depend on how much you really need to engage in these things. But studying the manual, which just means reading it a couple times, that's a big plus with the worksheets, thinking through how, okay, now I pull out this worksheet, now, oh no, this is a guided interview, etc. It can help to rehearse. So it can be tough to rehearse with a colleague, but you can rehearse with yourself. Imagine there's a teenager and you just sit down and you verbalize the things that you're gonna be doing in a live session. Have the worksheets, pretend you're pulling them out and handing them over. You even imagine maybe what kind of reaction you might get in certain situations, and you come back with how you you might respond. You know you're going to get some teenagers say, no, I don't know, maybe, I don't have much to say. How would you, try to encourage more discussion. Maybe you can get a colleague to role play with. That would be another plus. Of course, you could do the role play by going back and forth. So let's say you have a colleague and one pretends to be the teenager while you're the therapist for session one. Maybe, or break it in half. Half the session one is colleague, the therapist, one is teenager, and then you flip-flop for the second half of session one. You do session two the same way. So both of you are helping out each other. Part of the time you're role-playing the teenager, part of the time you're practicing. If you have the luxury, and if you're in a setting where you can audio tape sessions and then either self-review or have a colleague review them, that's a plus. Now, audio taping sessions can be standard for some places, but I know that some clients are uncomfortable with it, and that might be a barrier. Only do it if you think it's not going to interfere with your with the therapy process. And surely you can use supervision to help. And for people who have interest in asking questions about Teen Intervene, I'm more than happy to help out with that. So email me, and it's a chance for then us to, of course you might have the question that can be answered by email, no problem. Or maybe you want to have an extended mini supervision, 15 minutes on the telephone. Maybe it's a group telephone call where you have your colleagues all around the telephone with a speakerphone, and you want a chance to discuss several questions. Feel free with email to set up a phone conversation along those lines. Comments, questions on training? Do you want me to tell you how much the literature says people learn in a workshop? Well, good. You don't want to hear that. Good, because I don't want to. It's 99%.
Really?
Yeah, for very engaged people in South Florida. That's the data clearly.
I do want to know.
Yes. Yes. You guys are perfect. I don't have to worry about. It's a little disconcerting. People learn techniques in trainings, even practice, and then sometimes it doesn't play itself out in the real world. But let me give you a glass half full interpretation. I'm believing that even if you didn't follow very rigorously the manual, I got to believe you realize, yeah, there's a lot of benefit in doing this pros and cons type or decisional balance type exercise. And there's a lot of advantage for me at least setting some goals with a teenager, working with him or her, negotiating, where I'm not foisting it and coming up with my own rigid perspective, but I'm gonna modulate those goals based on where the teenager's motivation level is at. And I'll use that, whatever door open they're giving me, I'll use that as leverage and I can push the door open more or get more advanced goals downstream. And hopefully you've realized, to the extent you can get a parent involved is a huge plus, even if you're just talking to the parent about what's it like at home, how are you trying to connect and communicate with your teenager, and do you discuss rules, and do you set consequences, and do you follow through with them for the big things? Because that's important, even in the teenage years. Even though you might have a parent who's dealing with a 15, 16, or 17-year-old, and they're frustrated, the extent to which you can reinforce with parents the importance they have, even in the older teenager's life, is a huge plus. So I'm hoping those principles stay at the 99.9 percentile. Well, thanks for your time today. Appreciate the opportunity. Thank you.